Hi, my name is Susan, and I will be completing my health assessment on my volunteer patient, Kat. Good afternoon. I understand you're here for a physical. Is it okay if I complete a comprehensive assessment on you?
Yes.
Can you tell me your name?
Kat Johnson.
And what is your date of birth?
11/24/02.
Do you know what city you're in right now?
Tacoma.
And what is the year?
2023.
Patient is alert and oriented ×4. Do you have any medical issues or medications that you take?
No.
Patient's nutritional status is well developed. Her posture is upright. I am now assessing for any physical deformities or obvious mobility limitations. I am none noted. Her facial expression is appropriate for situation. Her mood and affect are appropriate. Speech is clear and appropriate. Personal hygiene is clean and kempt. Do you wear hearing aids, ma'am?
No.
Can you please tell me your height?
5'5".
And what is your weight?
105.
Okay. I'm now going to check her vital signs. I'm going to be checking her radial pulse on her wrist for 30 seconds, and then I will multiply that by 2. Patient's heart rate is 64. Pulse is regular. I'm now going to be counting her breathing for 30 seconds and multiplying it by 2. Respiratory rate is 16, unlabored, regular. I'm now going to be checking her blood pressure with my automatic blood pressure cuff. Borrow your left arm here. And relax your arm. Blood pressure is 111/83. On a scale of 0 to 10, are you in any pain right now?
0. No.
Okay. I'm now going to be assessing both your hands. I am assessing for the warmth of the hands, swelling, and to see if they are dry or moist. I'm assessing for nail ridges, looking for yellowing of the nails, clubbing of the fingers, thickness. I'm checking the capillary refill on both hands, all fingers. Capillary refill on left and right, less than 2 seconds. Hands are both normal. Color is consistent with ethnic background. There are no lesions or sores. Texture is smooth, non-tenting. I'm now going to assess the head and the face. I'm assessing the face, scalp, and hair. I'm assessing to see if there are any lesions, lumps, scaling, or evidence of trauma. Any pain or tenderness to your head or your face?
No.
Okay. Any other issues with your head?
No.
Okay. I'm now going to assess cranial nerve 7. Can you frown for me? And smile. Show your teeth. And puff out your cheeks. No abnormalities seen. Cranial nerve 7 is intact. I'm now going to assess her eyes. I am assessing for ptosis, lid lag, discharge, and crusting. Hair has even distribution, both eyes, eyebrows. They're symmetric. There is no jaundice, lesions, or redness, and sclera is white. Do you have any problems with your eyes?
No.
I'm now going to shine a light in your eyes to assess your pupils and assess the sclera to check on the color. I'm assessing the size and the pupils to see if they're equal, round, and reactive to light. They are equal, round, and reactive. Pupils on the left are 3 millimeters at rest and 2 millimeters with constriction. Pupils on the right are 3 millimeters at rest and 2 millimeters with restriction. Sclera is white. No crusting or other issues noted of the eyes. I'm going to bring my pen light towards you. Pupils are accommodating. I'm now going to test cranial nerve 2 to assess for computation. I'm going to have you put this over your eye, like this. Good. Now you're going to tell me we can see my hand, okay?
I can see it.
Okay. Now change eye.
I can see it.
Okay. All right. Cranial nerve 2 is intact with no abnormalities. I'm now going to assess her extraocular muscles. I'm going to have you follow my finger with your eyes without turning your head. Extraocular muscles are intact. I'm now going to assess her corneal light reflex. I'm going to shine a light in your eyes one more time. If you could focus on the light for me, I'm assessing to determine if the reflex is present and symmetrical. Reflex is present and symmetrical. I'm now going to assess her ears. I'm going to assess both ears to look for lesions, tenderness, or drainage. No lesions, redness, or drainage on right or left. Any pain or tenderness to your ears?
No.
Any ringing in your ears?
No.
Okay. Do you wear hearing aids?
No.
I'm now going to assess her nose. I'm looking for symmetry, drainage, redness, Nose is symmetrical, no drainage noted, no crusting. Do you have any pain or issues with your nose?
No.
Okay, I'm going to test the patency of her nostrils now. I'm going to have you close one nostril and sniff, and then do the same on the other side. Okay. Do you get nosebleeds?
No.
Okay. Now I'm going to assess the mouth and the throat. How many times a day do you brush your teeth?
2.
And do you floss daily?
No.
When was your last dental visit?
A year ago.
Do your gums bleed easily?
No.
Any bleeding noted in your mouth at all?
No.
Okay. I'm now going to check her mouth, tongue, teeth, and gums. Okay, open your mouth. I am assessing her lips for color to determine if they are moist and dry. I'm checking her mouth, tongue, teeth, and gums. You can close your mouth. Teeth are not discolored, no signs of caries. I'm looking for color and moisture. The gums are not red or swollen. Her tongue is moist and pink. I'm now going to assess cranial nerves 9 and 10. I'm going to be checking the uvula to make sure it is intact and midline. I'm going to be using this as my tongue dispenser. You open your mouth and say ah.
Ah. Ah.
Okay. Uvula is midline, gag reflex is intact. I'm now going to assess her neck, assessing for lumps or lesions. Any pain or tenderness to your neck?
No.
I'm going to be assessing the carotid pulse, both sides. They're palpable on both sides. I'm assessing her trachea. Trachea is midline. Now I'm going to be checking her range of motion and muscle strength, assessing cranial nerve 11. Can you move your head around? Good. And both sides. Good. Okay, I'm going to have you push against my hand. On the other side. Now push forward against the hand and back. Okay, I'm going to have you shrug your shoulders and then push against my hands. Good. Has full range of motion with his neck and can shrug shoulders. Cranial nerve 11 is intact. I'm now going to be testing her posterior chest and legs. Okay, I'm going to have you turn around and I'm going to move the chair forward a little bit. I'm assessing her thoracic cage. I'm feeling the thoracic cage, checking to make sure there's no use of accessory muscles, no barrel chest. Patient has asymmetrical expansion. Any pain or tenderness in your back?
No.
I'm now going to assess for tactile fremitus. As I touch your back, I want you to say 99 with each touch.
99. 99. 99. 99. 99. 99. 99.
Okay. No lumps or tenderness present on doing that. I will now assess CVA angle for tenderness. Do you feel any tenderness with that?
No.
Okay. I'm now going to be listening to posterior breath sounds. I'm listening for any diminished breath sounds, bronchi, crackles, or wheezes. If you could please breathe in and out deeply each time I change position. Lungs are clear to auscultation. Okay, I'm going to have you turn around and face forward again. I'm now assessing her anterior chest and lungs. I'm assessing her thoracic cage, making sure it is symmetrical with no use of accessory muscles when breathing. No barrel thrust, symmetrical expansion. Any pain or tenderness?
No.
Okay, I'm going to assess for tactile fremitus again. I want you to say 99 each time I change my hand position.
99. 99. 99. 99. 99. 99.
No lumps or tenderness noted. I'm now going to listen for interior breath sounds. You can just breathe normally. I'm listening for any diminished breath sounds, bronchi, crackles, or expiratory or inspiratory wheezes. Lungs are clear to auscultation. I'm now going to check for her apical pulse. I'm going to palpate first. Apical pulse is palpable. I'm now going to listen with my stethoscope for a full 60 seconds in the same location. Rate is regular and 64. I'm now going to be listening for S1 and S2 to check for a murmur. S1 and S2 sounds present, no murmur noted. I'm now going to be testing her upper extremities, checking for range of motion and muscle strength. I'm going to have you stand up. Have you put your hands behind your back and then put them out. Good. Now have you raise both arms over your head and down. Put your hands out in front of you and cross them, and the other way. Okay, bend your elbows and then straighten them. Turn your palms up towards the ceiling and down towards the floor. Squeeze my hands, and then I want you to press against my hands and pull against my hands. Patient has full range of motion on the left and full range of motion in the front. Equal strength bilaterally and strong to the right and left. I'm now going to check her brachial pulse and her radial pulse. On the left, brachial pulse is 2+ and normal. Left radial pulse is 2+ and normal. Right brachial pulse, 2+ and normal. And right radial pulse, 2+ and normal. I'm going to have you lay down on the couch now. Observing for jugular distension. Let's see. No jugular distension noted. I'm now going to assess her abdomen. Abdomen is rounded, symmetrical, no masses, no pulsing, no bulging. Umbilicus is midline and inverted. I'm now going to listen to her bell tones. I will be listening in all 4 quadrants. I'm checking to see if the bells are hypo, hyper, hypoactive, hyperactive, and if they're normal. Bell sounds are active in all 4 quadrants. I'm now going to palpate her abdomen, starting with light, and she will tell me if there's any tenderness. Any tenderness?
No.
Okay. Now I'm going to assess by pushing a little bit deeper. Any pain or tenderness?
No.
Her abdomen is soft and there are no masses. Now I'm going to be percussing her abdomen. In all 4 quadrants. Tympany and no dullness are noted. Any pain when I did that?
No.
Okay. I'm now going to assess her lower extremities. I'm looking for symmetry. Legs are symmetrical. Color is appropriate. There are no lesions. Hair is evenly distributed and there is no edema present. I'm going to assess her toenails, look for abnormalities. I am checking the capillary refill on both left and right, all 5 toes. Left is less than 2 seconds, right is less than 2 seconds. Skin is warm and dry with no edema. I'm now going to assess her pulses, starting with the right femoral. Right femoral groin is 2+. Left femoral groin is 2+. Right popliteal pulse is 2+. Left popliteal pulse is 2+ and normal. Right posterior tibial pulse 2+ and normal. Left posterior tibial pulse 2+ and normal. Right dorsal pedis pulse is 2+ and normal. Left dorsal pedis pulse is 2+ and normal. Now I'm going to be assessing for hips. I'm checking for pain, tenderness, and range of motion. Do you have any pain or tenderness in your hips?
No.
I'm feeling the hips. I'm feeling for crepitus and instability. Hips are normal with no abnormalities noted. Okay, I'm going to check her hips for a 90-degree rotation. Please lift your right leg up to the ceiling and back down. Left leg, 90-degree rotation, intact. Now I'm going to have you bend your right knee and then your left knee. Abduction 90 degrees and normal. Now I'll have you bend this leg again and turn it in and then out. Both internal and external rotation to the right leg are normal. Now I'll have you do the same on the left. Bend in and out. Internal and external rotation are intact and normal on the left. Patient has full range of motion. Now I'm going to assess her ankles. Do you have any pain on your ankles?
No.
No swelling, no ulcers. No swelling, no ulcers, no redness noted. No edema. Okay, I'm gonna test for her plantar flexation now. I want you to put your toes down. And then I'm going to have both your toes up. Both plantar and dorsal flexion are intact on both left and right. Now I'm testing for aversion. I'm going to have you put your feet out like that, just your toes. Aversion is intact on both left and right. Range of motion is normal and strong. Okay, you can sit back up for me now. Okay. Now I'm going to be assessing her deep tendon reflexes. I'm going to be using the bell of my stethoscope for this. I'm going to be doing this on both arms. First on the right, I'll be testing the bicep and the tricep. And the brachioradialis. I will do the same on the left arm now. Was the bicep, the tricep, the brachioradialis. Now I'm going to test the patella. Left first. And now right. And I'm going to test her Achilles. Both left and right. Reflexes are present and strong in all areas. I'm now going to test her sensation. I'm going to have her close her eyes, and then I'm going to use my Q-tip to test for strong or sharp. I'm going to have you close your eyes, and then I'm going to touch different parts, and you tell me if it's soft or sharp.
Okay. Soft. Soft. Sharp. 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 Soft. 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 Sharp. Sharp. Have her hold her feet up. Soft. Sharp. Sensation is present in all areas. Do you mind standing up for me? Okay. I have you bend over and touch your toes. I'm assessing for range of motion, and I'm assessing her spine, checking for symmetry and tenderness. Any tenderness or pain when you're bending over there? No.
Okay. Palpating spine, there is no abnormalities. You can stand up. I am further going to assess her range of motion. Okay. I'm going to have you lean from side to side for me. And then turn left and right. And then I'm going to have you bend backwards. Range of motion is fully intact. Any pain when you were doing that?
No.
Okay. Can you do a shallow knee bend for me? I'm assessing for symmetry while she's doing this and full range of motion by having her slightly squat. Any pain when you're doing that?
No.
Okay, you can stand back up. Okay, I'm now going to have her walk across the room. Okay, I'm going to have you walk using a heel toe
across the room. Okay. Patient has appropriate coordination. Now I'm going to have you walk back on tiptoe. And then back on your heels. Okay. Patient has full coordination. You can sit down. Okay. Is there anything else you feel I should know?
No.
Okay. I'd now like to discuss a couple educational items with you. I'd like to discuss the importance of good sleep habits. How well do you sleep at night? How many hours?
About 5 to 6.
Okay. Healthy sleep habits are important to your overall health. They promote an improved mood, healthy heart, regulated blood sugar, improved mental function, restored immune system, stress relief, athletic performance. They help you maintain a healthy weight. I'd like you to make a goal to achieve 7 to 8 hours of sleep at night. Do you think you can work on that with me?
Yes.
Okay. And now I'd like to discuss dental health with you as the second item. You mentioned that you haven't seen your dentist for a year. Is that correct?
Correct.
Okay. Dental health is an important part of your physical health. I recommend that you do the following for good oral health. Brush your teeth at least twice daily for 2 minutes each time. Use a soft bristled brush and fluoride toothpaste. Floss twice daily. Use mouthwash after you brush and floss to remove any particles that were left from the brushing and flossing. Work on eating a healthy diet and limit sugary foods and drinks. Replace your toothbrush every 3 to 4 months or sooner if the bristles become splayed or worn. Schedule regular dental checkups and cleaning. Normally every 6 months is appropriate. And then avoid tobacco use. I can provide you with some more information on that as attachments with your after visit summary if you'd like. Do you have any questions?
No.
Okay, thank you for coming in today. If you have any issues, please follow up with your primary care provider.
Thank you.